Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, Dr. Michaels.
Thank you, Angie.
Our question for you is, what is Hallux limitus?
Well, Hallux limitus describes the big toe. The hallux is the big toe, and limitus, it doesn't move. So if you have the foot model here, the big toe usually goes up and it goes down. But in this case, with Hallux limitus, it doesn't move that much. That can be caused by arthritis. Sometimes, this joint takes the brunt of the force in the forefoot, so damage can occur to this. For example, if you stub your toe as a child or a young adult, or you had trauma to this area, it may not hurt right then, but that could have damaged the cartilage in the joint, which then degrades over the years, and later in life you have bone spurs forming in this area, and the bone spurs that form on the top of the toe can prevent the toe from going up. And oftentimes people have some degree of this, but they're not symptomatic. They don't have pain. And if it's not painful, you don't really need treatment. But if it does become painful and debilitating, then something needs to be done about that. It can also be caused by elevated first ray. There are certain types of foot conditions that can cause malalignment of some of the bones, and that can cause a structural problem where the big toe doesn't go up. So it's not always caused by arthritis, but usually.
All right, how is Hallux limitus treated?
Well, we try to treat Hallux limitus conservatively first. Everything we do is usually conservative, and then we move on to surgical treatment. So one of the things that we do for this primarily is to wear and recommend really good shoes. The shoes for this that would help are stiff-soled shoes. They shouldn't bend, because if you're having pain when the big toe bends because of the arthritis, then if you wear a stiff-soled shoe, your big toe won't bend that much. And I know a lot of the stores in our office sells really stiff-soled hiking shoes that are designed for off-road use. In addition to that, orthotics, custom foot orthotics with a thickening underneath the big toe can provide some relief for this. And those two things, the orthopedic shoes or the stiff-soled shoes and orthotics, are really the best ways to treat this conservatively. Now, sometimes we can do injections of steroid or of a joint fluid replacement for this. And sometimes if the steroid doesn't work, then you do the joint fluid replacement, which is fairly new, and not a lot of people do that yet. But it has shown that one of these joint fluid replacement shots can work for about 6 months. And then finally, if that doesn't work, then surgery may be indicated, and usually it's a surgery where you can be awake, you can walk that day. It's simply a clean-out procedure where we take out some of the arthritis. Sometimes something more advanced needs to be done, but usually the clean-out procedure takes away the pain and takes away the bone bump, and people have their symptoms resolved right after that.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com.